Hi, in this video, I'm going to be talking about hospice. There are a lot of myths about hospice that I hope to address. Before I do that though, I'd like to invite you to subscribe to our channel. And also, don't forget you can visit Yerbba.com to get your personalized report. So hospice is an interesting thing. It's sort of got a reputation of being the last part of your life and something you do only when you're dying. Going on hospice means it's the end or that you're giving up. I've heard it all. People won't even let us use the word hospice sometimes. I actually find it's very helpful to talk about hospice when you are not a candidate for hospice, because that way you can learn when you are not emotionally anxious or worried. So for my patients who are living with advanced disease, or if you're watching this because somebody you love has advanced disease, this is a great time to learn about hospice when you are up and about and not even eligible. So I've mentioned eligible a couple times. What does that mean? You are eligible for hospice if your life expectancy is less than 6 months. And you can actually be on hospice for longer than that. So if you are living with advanced disease and you ask your medical team, would you be surprised if I were to die within the next 6 months? And they say no, they're really going to hesitate to answer that question because they don't want you to feel they're giving up on you, but they're not. So you would be eligible for hospice. You can learn about hospice at any time. You can figure out what insurance, what hospices your insurance will cover and which ones they won't. You can ask around to see people's experiences. You can go visit with them and meet with a nurse and learn all about it. Why would you want to do this? Well, hospice is interesting. Hospice is very patient-centered. It's not focused on the cancer, it's focused on the patient. So when you're living with advanced disease, you have a lot of symptoms. You don't need me to tell you this. You have a lot of symptoms like nausea and pain, and you may have difficulty transferring from a bed to a chair. You may need some help with personal care, bathing, or with medications. Their family may be struggling with overwhelm. You may have a lot of questions and wondering about, what does this all mean? What has my life meant? All of these things are things that hospice can do better than almost any other doctor or other healthcare provider. So hospice is focused on treating the person, their symptoms, psychological symptoms. They can help the family. They actually, even after a patient dies, they can give bereavement support to a family. And the longer you can be on hospice, the more you can gain all of those benefits. So learning early and often about hospice and having those conversations will actually not take away your hope. It actually helps you be more realistic. It's interesting, there's a lot of people who worry if we give the truth to a patient, we're going to take away the hope. And actually the research suggests the opposite. When people feel that their doctors and other healthcare team members are being honest with them, they actually have more hope. Isn't that interesting? So hospice, which your insurance will cover, is directed at you, not the cancer. So in general, but not always, we stop cancer-directed therapy because guess what? It's not working anymore, or it may be causing more symptoms than benefit. So I had a patient who was on multiple treatments, treatment after treatment after treatment. None of them were working. And she finally said, I am done. I'd like to go on hospice. And she felt better than she had in 3 years because she wasn't on chemo. And actually one day I called her house just to check in with the family, and she had rented a movie theater for all of her friends. She was feeling better than ever. It sounds like people live a long time on hospice, and that's actually the case. If you are getting no benefit and only the toxicity of treatment, you're not going to live longer, you're going to live worse and actually shorter. There are lots of studies showing that people on hospice live longer. Now, there are some models of care that are being explored where you could still be on anti-cancer treatment and be on hospice at the same time. So that's a nice way to sort of ease into maximal supportive care, which is what hospice is, and still stay on anti-cancer therapy to see if it might help you. So it's something worth asking about. You can talk to your insurance company about it. And these are novel ways that we're trying to go about meeting the needs of our patients. When I talk about hospice, I'm talking about aggressive supportive care. So you may hear people say, I don't want to do nothing. How can I just do nothing? We're never doing nothing. Sometimes doctors will say, there's nothing we can do to help you. And that's actually not true. There's a lot we can do. We can manage your symptoms. We can be a support for you, a sounding board for you and your family. We can help you find a clinical trial. There are so many things we can do. I actually feel really bad for cancer providers and clinicians who say there's nothing more we can do, as if they don't matter anymore. They've been with you on this whole journey. Staying in touch with them is really important. It's also thought that some people think that you can't have procedures done if you're on hospice. So if you have fluid accumulating in your abdomen, that you can't have that fluid removed. And that's actually not usually the case. Hospice usually will make sure that you can have procedures for comfort. Remember, all of this is about your comfort. So I want to encourage you to learn more about hospice. Don't believe everything you hear. This is the source of truth. Hospice is really the best way to manage your symptoms when cancer-directed treatment isn't working. And for some people, you can actually get both cancer-directed treatment and hospice services as well. I've covered a lot. I hope it's been helpful. Please put comments or questions below. If this blew your mind, let me know that. Let me know your experience with hospice. It's not always a great experience, just like every time we go get our hair cut. It might not be a great haircut, in which case we make a switch. So you just have to stay in touch with your team. Thanks for watching.